cardiorespiratory fitness or aerobic fitness is an objective measure of how well we get oxygen from the environment into our lungs, into our bloodstream, to our muscles and our other organs. Now, as we age, our cardiorespiratory fitness declines. Now, why is this important? Because there are many scientific studies and epidemiological studies that have shown that people with low cardiorespiratory fitness have a higher risk of developing type 2 diabetes. In this video, I will review how low cardiorespiratory fitness is associated with diabetes and how exercise can help. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. So low cardiorespiratory fitness creates an increased risk for developing type 2 diabetes. For example, there was a study of over 8,000 non-diabetic men who were followed for about 6 years, measured their cardiorespiratory fitness using a treadmill test. And what they found was that in the least fit group, those who were in the lowest 20% of cardiorespiratory fitness, had a 3.7 times higher risk of developing diabetes compared to those who were in the highest fitness group. An additional interesting finding in this study was that 93% of those people who had ended up developing diabetes had no idea they had diabetes until they went to their doctor and had a blood test that checked for it. So this highlights the importance for everybody to every year get an annual physical exam with blood tests to check. Now, in a similar study that looked at over 1.5 million people, these were people who were conscripted into the Swedish military, they followed them for almost 25 years. And what they found was, again, that those people who had low cardiorespiratory fitness and low muscle strength had over a 3-fold higher risk of developing type 2 diabetes versus those who had high cardiorespiratory fitness and strength. Many patients who are overweight or obese are the ones who are at risk for developing type 2 diabetes. So what is the interplay with cardiorespiratory fitness? So in a prospective study of 14,000 men without a history of type 2 diabetes, and what they found was that obese men with a BMI over 30 had a 2.5 times greater risk of developing type 2 diabetes compared to those who were non-obese. But very interestingly, they found that in those people who were obese but were fit, had a high cardiorespiratory fitness, they had a 53% lower risk of developing type 2 diabetes compared to obese men with low cardiorespiratory fitness. So this is important information. So for those people who are obese, trying to aim for a higher cardiorespiratory fitness level can also help reduce their risk of developing type 2 diabetes. As cardiorespiratory fitness increases, our risk of developing type 2 diabetes decreases. So it's an inverse relationship, but it's also incremental. With each little improvement in cardiorespiratory fitness, we see a little more reduction in our risk of developing type 2 diabetes. How do we measure cardiorespiratory fitness? What's our measurement scale? We can use a scoring system, if you like, called metabolic equivalents to help measure cardiorespiratory fitness. For example, one metabolic equivalent is defined as the amount of oxygen someone consumes while just sitting at rest. And then let's say you're walking at 3 miles per hour, that would measure about 3.5 metabolic equivalent. So this is a way to measure. And so we can use this metabolic equivalent to see and measure what someone's cardiorespiratory fitness level is. And so there was a meta-analysis of 1.6 million participants, and they found that for each one metabolic equivalent higher in cardiorespiratory fitness was associated with an 8% lower relative risk of developing type 2 diabetes. So this again demonstrates this incremental improvement and reduction of developing type 2 diabetes. Where's the role for exercise? Unfortunately, cardiorespiratory fitness is strongly controlled by our genetics and our age. But the good news is that exercise can improve our cardiorespiratory fitness anyway. For example, a meta-analysis of 34 studies with almost 2,000 participants, and they were able to show that resistance training could improve cardiorespiratory fitness by 17%, and aerobic training can improve it by 21%. So here we can see that we are able to improve our cardiorespiratory fitness, and therefore we should be able to reduce our risk of developing type 2 diabetes. Let's wrap up this video and go over a few key points. Number one, having low cardiorespiratory fitness increases your risk of developing type 2 diabetes. Number two, obesity exacerbates the risk of developing type 2 diabetes. But in those patients who are obese, they can still reduce their risk of developing type 2 diabetes by having better cardiorespiratory fitness. And number three, how can we improve our cardiorespiratory fitness? That's through exercise. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.